Hi, in this video we will be seeing OREM'S self-care model with the main points only. If you want to get a detailed understanding of OREM'S theory, kindly go through the another video which is described in detail. If you are doing your master's or doctoral program, kindly go through the detailed one. A nurse must always ask two questions when she is near the patient. What is the condition now and what can be done in the particular condition? So this is the basis of OREM'S self-care deficit nursing theory. Two questions, what is the condition now and what can be done in the particular condition? There are certain assumptions the theorist had before she developed the theory. One is, we all human beings, all patients wish to care for themselves. Humans are capable and willing to do the self-care activity and also to care for the dependent members of the family. Self-care and dependent care are learned behaviors through communication and interaction with each other. Even we learn self-care from our parents or the seniors. Nursing is a deliberate helping action performed by nurses for the benefit of the patient, and it is done for a certain period of time. Humans are unique individuals that are separated from each other and from their environment. All human beings are different and needs to be cared in a different way. OREM'S general theory of nursing is also known as self-care deficit nursing theory or OREM'S self-care theory. There are four main components of this OREM'S model. One is theory of self-care, second is theory of dependent care, third theory of self-care deficit, and fourth theory of nursing system. Theory of self-care means human beings learn and perform actions for their well-being of life, for self-care. Theory of dependent care means family members provide dependent care for the person who are socially dependent, like a child or a mentally retarded person or somebody with fracture who is at home. Theory of self-care deficit. Inability to perform self-care needs because of some illness or limitation, that is self-care deficit theory. And theory of nursing system means use of the nursing process to meet the self-care needs of the patient. So we will see this in detail. There are many concepts or building blocks for this theory. The main concepts are self-care, self-care agency, therapeutic self-care demand, self-care deficit. Along with this, we can add up dependent care agency, dependent care demand, dependent care deficit. Dependent care means somebody else is doing the self-care for that particular person. These four aspects are related to the patient. And two aspects, nursing agency and nursing system, are related to the nurse. And there is something which is known as basic conditioning factors that is related to the patient or the person, the family member, and even the nurse. We will see all these concepts in detail. Again, the OREM'S self-care model, we can tell it is divided into three parts. The self-care part, which includes self-care or dependent care, self-care agency or dependent care agency, self-care requisite or dependent care requisite, therapeutic self-care demand or dependent care demand. Self-care deficit. Here, how the nurse can help the patient. It can be done in 5 ways. A nursing system, how we care for the patient, is divided into wholly compensatory, partially compensatory, and supportive educative. Self-care. According to OREM, self-care means all the individuals perform activities they initiate it by themselves to maintain their health, life and well-being. This is initiated by the patient themselves, all the persons themselves, like exercise, sleep, hobby, connecting with friends. These are all our self-care. Dependent care is something which is performed by mature or responsible person towards someone who is not capable of doing, like an infant or a child or a cognitively impaired person. This picture clearly shows that. Then self-care agency or dependent care agency. To understand this, you need to know the meaning of the term agency. Agency means the capability each person is having. So self-care agency means the capability for doing the self-care for a person. And dependent care agency means the capability of that caregiver who is doing the care. Therapeutic self-care demand or dependent care demand. All the self-care actions should be directed towards the health of the patient. Whatever we do, it should be for the benefit of the patient's health. That is what self-care, therapeutic self-care demand is. The term therapeutic means it should be beneficial to the patient. Therapeutic self-care demand therefore requires extensive nursing knowledge. Without knowledge, a nurse cannot give a therapeutic self-care to any patient. Self-care requisite, that means the needs of the patient. Actually, all the persons, all the human beings have got three types of self-care requisites. They are universal, developmental, and health deviation. Universal is required by all human beings of all ages at all conditions. Air, water, food, eliminatory function, activity balance with rest, time spent alone and with others, prevention of danger to self, and being normal. This is something like Maslow's hierarchy, and every human being need to meet this universal self-care needs. Second is developmental self-care requisite, that is classified into three. Once the person is growing or developing, they need some needs, like that is for the general human development process, or when they are developing by self, maintaining a positive mental health, they need some developmental needs. And third, when some crisis emerges in the life of a person, like death of a family member, at that time they need some care. So these are developmental self-care requisites. Third is health deviation self-care requisite. When the person is having any disease or injury or under medical professionals care, at that time some self-care is required. If some fracture happen, so at that time you need to move with crutches. That is a self-care which the person needs. So that comes in health deviation self-care requisite. Self-care deficit or dependent care deficit. This shows when nursing is needed. When a deficit is there to care for themselves, at that time only nursing is required. So this is the kite picture which is shown given by OREM, which clearly explains when nursing is required. Every person has got self-care, the capability to do the self-care. Every person needs self-care, and the self-care agency is their ability, and these two are related. And every person's capability will depend upon certain factors like his or her age, gender, developmental state, knowledge, health state, family factors, environmental factors. So certain factors will result in their capabilities. And there is something known as therapeutic self-care demand. For maintaining good health, they need some self-care. If that therapeutic demand is more and the capability of that particular person is less, at that time self-care deficit will happen. Self-care deficit means the person is not capable to perform the self-care needs. So at that time nursing agency will come into force. So nursing agency also has got certain basic conditional factors like the nurse's health, the nurse's education, nurse's experience, nurse's maturity. All this will affect the self-care things which the nurse is acting on the patient. So this is the Kite model of OREM'S theory. Basic conditioning factors already told, there are number of factors which is included in this basic conditioning factors for the person, for the nurse and for the family member. And these can be, for example, for a nurse, this can be nursing experience and education. If a nurse is not healthy, she won't be able to take care of the patient. And there are 5 methods in which a nurse can help the patient. One is we can do for others. Another teaching. Third one guiding and directing. Fourth one we can provide physical or psychological support. And we can also provide some environmental modifications and development. Theory of nursing system. According to this, the nurse will act as a caring. Theory of nursing system. In this, there are 3 ways in which nurse will be providing care. One is wholly compensatory, that means the total care nurse will be providing. Partially compensatory, little bit of care the nurse will be providing. And third is supportive educative system. So from the picture it is very clear, when the patient is in ventilator in the ICU, wholly compensatory. When the patient is shifted to the ward, at that time we need to give partially compensatory. And when the person just need supportive educative things. So when it is wholly compensatory, the entire actions nurses are doing. When it is partially compensatory, the nurse and patient together they will be performing. And in supportive educative, education and support will be provided by the nurse, and the patient will be acting for the self-care. Nursing agency means the capability or ability of the nurse. It can depend on the nurse's education, experience, her health, her family and all. Nurse's ability or nursing agency. Characteristics of theory. It relate the concept. All the 6 concept and basic conditioning factors are all related in this theory. This theory looks logical in nature, and it is simple and generalizable to all persons. This theory can be tested, and it will increase the general body of knowledge when we are applying this theory. And when a practitioner is applying, it can improve the practice. And also this theory is consistent with other theories like Maslow's theory. Understanding the nursing metaparadigms and OREM'S theory. Metaparadigms means how our nursing discipline should be. According to Fawcett, it is classified into 4. OREM'S theory and the metaparadigm person, who a person should be according to OREM. Person is the recipient of care. A person is a human being who functions biologically and socially. Person has the potential for learning and development. Person is subject to the forces of nature, has the capacity for self-knowledge, can engage in deliberate action, interpret experience and perform beneficial actions, and can learn to meet the self-care needs. According to OREM, environment is external physical and psychosocial surroundings. It includes the family, culture and community. It can positively and negatively impact a person's ability to provide self-care. Third one, health. Health is function of daily living, and progressive development to a higher level of functioning is health. Nursing according to OREM is a geared service towards helping the self and others, and it is required when self-care demand exceed the patient's ability to provide the self-care. It promotes the patient as the self-care agent. The role theory is also there in nursing. There is a particular role for the nurse and for the patient, but that is complementing with each other when they are working for the development of self-care. It supports health promotion and health maintenance. Nursing will support the health maintenance, and it supports the holistic health of the patient for the entire health. OREM'S nursing process has 3 steps. One is determine why a patient needs the care. Second, we have to decide which system of care nurse has to provide, whether it should be wholly compensatory, partially compensatory or simply supportive educative. And third one is implementation and evaluation of the nursing care. So this is how we will be comparing nursing process with OREM'S nursing process. When you are writing OREM'S nursing process, you have to just write 3 steps. The first is regarding the diagnosis and prescription, where you will be understanding the patient's problem. Second one is designing the nursing system. There you will be writing which system of care you provided, whether it was a wholly compensatory, partially compensatory or supportive educative. And the third part of the nursing process, you will be writing what are the implementations you did and what is the outcome. There are certain strength and weakness for this theory. The strength first. It gives general foundation for the nursing discipline. It can be utilized for developing our nursing curriculum. It will enhance nursing education, research and administration. It identifies when nursing is required. This is the most important strength. It identifies when nursing is required. And also It is contemporary. Now also with the nursing trends we can use this theory, and it promote independence for a nurse. So these 2 points, it identifies when nursing is required and it promotes independence of a nurse. These 2 points are very important relating to OREM'S theory. And when we are talking about the weakness, certain terms are confusing and the theory didn't deal with any emotional needs, and it is more oriented towards illness than wellness. And initially in her initial first theory when she developed, it was like she assumed all are capable of self-care, but later on in the last edition she told the dependent care also, so that we cannot consider as a weakness now. The critic of this theory. This theory has got a purpose. That means when care is to be provided, it defines clearly and it focuses not only on individual self-care but also on the family's health care. Clarity. All the concepts are very clear in this theory and it is not borrowed from any other discipline. It is a very simple theory. It can be used in all the areas, and also with the simple diagram we can explain the theory. And generality, it can be used in all the situations like rehabilitation, emergency department, intensive care unit, medical surgical unit, and will show when care is required by the individual. And the accessibility of this theory is, it is the building block of knowledge towards nursing practice. And the importance of this theory is, now also this theory defines what is the need of nursing care. So this is about the critique of the theory.